Well, 3 or 4 times a year, I got to talk about doctors' mistakes. That is the third most common cause of death in patients is doctors' mistakes. Number 1 is doctors and their procedures. Their conscious directed procedures is cause number 1. Number 3 is doctors' mistakes. Well, what I want you to do, I want everybody out there in America to forget petitions to the doctors, forget petitions to the government, because they're not going to respond. Remember, doctors since 1914, 100 years ago, for 100 years, they've been the only protected monopoly in America. They're self-policing, and nobody audits them. Nobody has oversight over them. As a result, they've learned how to kill, pillage, and rape and burn without consequences to them. Okay? So I want everybody to get on the 90 essential nutrients, give yourself the best chance to fulfill your genetic potential for health and for longevity. Remember, your genes, your RNA, and your DNA require nutrients. They don't work by themselves, so you need some help here, and you're not going to get it out of your food. Forget that. I don't care how well you eat. You're not going to get it from your food. Remember, billionaires' average lifespan is 66. Doctors' average lifespan is 56. Professional athletes are 62, except for football players, 51. So how do you get to live beyond 100 chronologically and still have a biological age of maybe 30 or 40? Okay? Well, here's how you do it. You get a hold of the trilogy of books. Let's Play Doctor, Let's Play Herbal Doctor, and the Passport to Aromatherapy. Do your own lab work every month, every 2 months, every quarter, whatever is comfortable for you. It'll cost you about $5. You can go to a pharmacy and get all the lab material you need, test strips for urine, test strips for blood. You can make your own diagnosis of diabetes, high blood pressure, heart disease. You can find out things from your urinalysis. You can find out if you have kidney failure. The book, again, Let's Play Doctor, is very unique, and it goes through all the laboratory tests you can do. You can tell people, I've got parasites. Well, which ones? Well, I don't know. I just know I have creepy crawlies in me. Well, it tells you, the book, Let's Play Doctor, teaches you how to do your own laboratory work for parasites, whether you're looking for the little one-celled things or you're looking for wormy parasites. It shows you how to do that. Very clearly, anybody can do it. I mean, a 6th grader can do it. Okay, so I want you to get a hold of that book, Let's Play Doctor. Also, it teaches you how to prevent diseases, how to deal with specialty diseases, diabetes, high blood pressure, arthritis, dementias, macular degeneration, fibromyalgia. All this stuff is in the trilogy books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport to Aromatherapy. And you'll learn how to deal with over 900 different diseases using vitamins and minerals and trace minerals and rare earths, amino acids, fatty acids, herbs, and aromatherapy oils. Don't forget, you don't need to go to a doctor for a colonoscopic exam. 79 to 80% accuracy, 79 to 80% accuracy, which is about the same or better than the colonoscopic exam without the risk of being punctured and killed by a belly infection. You can get a occult blood test at the pharmacy without a prescription. You can get another one. It's a new one called the FIT test, fecal immunochemical test. And this will give you equal results, or better in many cases, the results of colonoscopic exam for colon cancer without the risk of getting your intestines punctured. Do it yourself for less than $5. You can do it like twice a year, once a year, whatever you want to do. These are the things you can really do. Now, I've been taking the 90 essential nutrients plus secret sauces for every disease you can name. I have to pay for my own products. The company, Youngevity, doesn't give them to me. I pay for my own. And I haven't been to a doctor with me being the patient for 68 years. That's right, 68 years. I've never been on a prescription medication. And my pulse is 38 to 43. 43 is a little high for me. My blood pressure is 90 over 60. And I've never been to a doctor for me being sick. Okay, so what I want you to do is contact your Youngevity associate and ask for that trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport to Aromatherapy, and learn how to deal with over 900 different diseases using vitamins and minerals and trace minerals and rare earths, amino acids, fatty acids, herbs, and aromatherapy oils. Remember, doctors kill, injure, and infect 15 million of their patients every year in their workplace. They don't even get an OSHA ticket. They kill, according to the U.S. Department of Health and Human Services, Office of Inspector General, Medical Doctors America each month kills 15,000 Medicare patients. That's 180,000 a year. And, of course, that's just because they send them in for screening tests and minor procedures. And then they infect 2 million in hospitals alone, of which 90,000 die each year. Why on earth do you go to them? People tell me, well, insurance pays. Well, insurance is more of a struggle now. The deductible is very high. Well, you've been addicted to doctors. It's time to get off of the doctors. Right now, they're getting their patients addicted to pharmaceuticals, narcotics. So they have to come in every month. They only give them a prescription for 30 days. And they come in, and after when they need somebody because their kid needs tuition to get into college or the wife wants a new car, suddenly now you need to go in for a special test because your visit looks suspicious here. And so they'll run up $100,000 worth of tests. They'll put you in the hospital to find something to cut off a leg or take your eye out or whatever. So I urge you, don't put yourself as a victim. You have to begin to track this stuff yourself. Get that trilogy of books. Learn how to do your own laboratory work. Okay, you can do your own blood test. You can do your own urine test. You can do your own pulse and blood pressure. And you can do your own colonoscopy exams equivalent as the occult blood test and the FIT test. You'll be amazed at what you can do. This is very simple stuff, and you can do all this for less than $5. When we have family holidays, Christmas, Easter, Thanksgiving, anytime, you can have a barbecue, 4th of July, give everybody a physical. Give them the 90 essential nutrients for birthdays and Christmas and wedding presents. Don't give them a sweater, and we can save America. The doctors have failed us, so let's kick them to the curb and move on ourselves. Give us a call, toll free, 1-888-379-2552. We'll be back after these messages. Okay, Doug, what pearls of wisdom do you have for us?
We've got a Fox News story here headlined, Vitamin D boosts survival chances for bowel cancer patients, according to a study. And this study was actually funded by the Cancer Research UK. They say that every year in Europe there's 447 new cases of bowel cancer, which is also known as colon or colorectal cancer. It is the second most common cancer in Europe. What they did find, scientists studied almost 1,600 patients after bowel surgery for cancer, and those with the highest levels of vitamin D had half the risk of dying compared to those with the lowest levels. They say this study was the first to correlate the long-term survival prospects of bowel cancer patients after diagnosis. Say vitamin D, known as the sunshine vitamin, is made in the body when the skin is exposed to sunlight, also found in foods such as fish liver oil, eggs, fatty fish such as salmon, herring, and mackerel. It's known to boost the uptake of calcium and bone formation. Some observational studies have also suggested a link between low levels of vitamin D and greater risks of acute and chronic diseases. And this study was led by Malcolm Dunlop. He's a medical research, the Council Human Genetics Unit at the University of Edinburgh. And he was quoted as saying, it suggested that vitamin D supplements may be worth exploring for bowel cancer patients. In fact, this study was published in the journal Oncology, and they say they now plan to set up a clinical trial to test whether taking vitamin D tablets in combination with chemotherapy can improve the bowel cancer survival rates. So, once again, maybe just give them the calcium or a multivitamin of some sort and leave off the chemotherapy.
Well, here's where we require a flourish here, okay? We require a flourish. And the reason for that request for a flurry, Doug, is because we did a study with Clemson University, came out 2 years ago, and our product called Ultimate Classic, used as a nutrient for human colon cancer cells in culture, killed 95% of the cancer cells.
How come I didn't see that on the front page of the newspaper?
Well, we sent it out as a news release. Not one paper picked it up. We sent it out as a news. Clemson University did the study in human cell cultures with colon cancer. Our Ultimate Classic killed 95% of the cells that had colon cancer. 95%. Chemotherapy kills the patient. It does kill the cancer cells, but it also kills the patient 97% of the time. Okay? And, of course, our Ultimate Classic contains 88 of the 90 essential nutrients. The only thing you have to add to that is the EFA pluses, or the EFAs, right, to get the omega-3s in proper amounts. But here's a case where, plus you throw in ORIC points, get your ORIC points over 100,000 with Cell Shield RTQ, with the Triple Treat chocolate. We can do great things. And I just find it amazing how they trip around this vitamin stuff. Well, we give all 90, and then you don't have to do studies. The study's already been done. Scotland, are you Holmes. How come they didn't know that? It's elementary, Watson. Thank you so much, Doug. And ask your Youngevity associate for a copy of that Clemson study. It'll blow your mind. We'll be back after these messages. Okay, Doug, let's go to callers.
Let's head to Monroe, Louisiana. And Tyler, you're on with Dr. Wallach.
Well, Tyler, you're on the air.
Hey, Dr. Wallach, how are you?
Fine, sir. Thank you. How can I help you?
I'm calling about my stepmother. I guess it was about a month or so ago. She was having a problem in her right abdomen, a little pain. So she went to the doctor, and they did a CAT scan, and it came back. They said she had a renal neoplasm, and it was 5.8 centimeters, like a solid mass, on her kidney, her right kidney. And now they're wanting her to get a biopsy on the 23rd, and they're talking about maybe removing her kidney. And I was seeing if there's any other options.
Sure. Well, first of all, if it's how big is this? How many centimeters?
5.8.
5.8. Okay, that's like 2 inches in diameter. 2¼ inches in diameter.
Mm-hmm.
And definitely, I would go ahead and do an excision biopsy. In other words, cut the tumor out with plenty of pieces of kidney on it, so you're not going to nick that tumor. And it may be worth even taking out that one kidney. A person can live 200 years with one kidney, so you only need one. So it's not. And of course, you can effect a cure with renal cancer. If it is cancer, with renal cancer, you can actually effect a cure by removing the kidney and the tumor before it spreads.
Before it spreads. Okay.
Yeah, before it spreads. That's the secret. Before it spreads. So the earlier you get that done, the better. Now, here's the deal. I would have another radiologist evaluate that information. Look at the X-ray, get a second opinion, and find out if it's a cyst, if it's a benign tumor, or if it's a cancerous tumor. Obviously, if it's benign or a cyst, I wouldn't do anything. Okay? If it's cancerous, I would definitely remove that kidney. Okay? That can be a life-saving thing. If they catch it early enough, it affects a cure. Okay?
Definitely.
And so that's the option number one. And then regardless of what the thing is and what you're going to do about it, I would also. What does your stepmom weigh? Is she a big girl or small or what?
She's 190 and she's 6 foot tall.
Okay, tall lady. Okay. Well, it doesn't matter if she's 17 foot tall or 3 foot tall. It goes by body weight, and so 190 pounds. I would have her take 2 of the healthy heart and brain packs per month. It sounds kind of weird. Why would you give the heart and brain pack? Because it has so much stuff in it. That'll allow her to have 3 of our selenium at breakfast and dinner, 1 ounce of the OsteoFX Plus at breakfast and dinner, has a vitamin D3 in it also, and then 2 scoops of the Tangerine at breakfast and dinner, 3 of the EFA Plus at breakfast and dinner, and 3 of the EFAs at breakfast and dinner. Throw in the thyroid stuff, the Ocean's Gold, because it has sea cucumber in it, one of your best friends when you have tumors. Call us as soon as you get the second opinion. We'll be back after these messages.
Let's head to Michigan. And Dave, you're on with Dr. Wallach.
Hello, Dave. You're on the air.
Hello, Doc. This is Dave in the Thumb, Team Wallach's Way. How you doing?
Okay, sir. How can we help you?
Good. Well, I have a request and a question. I think it's necessary that you and maybe you and Doc Glidden do a webinar on coconut oil because there's a lot of misconceptions out there, and I think even some bigwigs at Youngevity aren't following your belief that coconut oil is oil in a bottle.
Mm-hmm. Okay, thanks for that heads up. Yep, oil is oil, whether it has 1 double bond or 3 or 5 or 10 double bonds. They just become trans fatty acids at different rates, but trans fatty acids are bad.
Right, and I'm trying to, clue my team in to your beliefs because everything is Wallach's Way. And also, I wondered if you know anything about turpentine therapy and Dr. Jennifer Daniels.
I do. Now, it's kind of interesting. She got fired as a doctor in the hospitals in New York. Jennifer Daniels, I know her very well. She's actually the co-author in the book Black Gene Lies. And so we're very, very proud of our relationship with her. Very interesting stuff. And, of course, if she'd used different words, she'd still be working there. Actually, turpentine comes from the black spruce. Okay, that's where they used to take the needles from the black spruce tree, put them in water, and they'd boil them. They used turpentine as paint thinner. Okay? And it actually kills bugs. You have sore throat, you can kind of gargle with turpentine water. But you can't use the word turpentine because it's looked at as a paint thinner. what you have to do is you look at our ancient legacy oils. Our ancient legacy oils, we have the black spruce. Okay, and black spruce oil will give you the same effects as turpentine. Now, turpentine was a great healer back in the slave days. This is some of the slave cures they used to use that. They would boil, they didn't have antibiotics, and they didn't have over-the-counter triple antibiotic creams and things like that. So they would boil needles from the black spruce or pine trees, and they would get the oil out of it and use that as a topical healing thing for infections and so forth. They would also drink it, inhale it for respiratory infections, and it's really a great healer. And, of course, it's the black spruce oil from Ancient Legacy, our division of aromatherapy oils. Get a hold of that book, The Passport to Aromatherapy, and you'll learn how to use black spruce oil, a.k.a. turpentine. Great question, Dave. We'll be back after these messages.
All right, let's head to Virginia. And Trey, you're on with Dr. Wallach.
Hello, Trey, you're on the air.
Hello, Doc. Thanks a lot for taking my call.
Yes, sir. How can we help you?
I have an aunt. She's in her mid-50s, and she's diagnosed with ALS.
Okay.
She's probably had it for close to 10 years. So I'm just trying to find out if there's a different way to cure her.
Sure. Well, you say she's just been diagnosed, but she had symptoms for 10 years. That's not unusual.
Yeah.
The doctors miss it quite easily in the beginning until they get full-blown advanced symptoms. Well, there's four diseases that are related here. Huntington's disease, which doctors believe is genetic, and then there's ALS, a.k.a. Lou Gehrig's disease, and then there's MS, multiple sclerosis, and Parkinson's disease. They're all kind of related. In fact, people with Huntington's disease have all the signs of all those diseases. And it's kind of funny that Huntington's disease appears in people's middle life like MS does and Parkinson's does and ALS does. It occurs kind of in their 35, 40, 50 years of age is the primary time when they're diagnosed, although we're seeing kids with MS 8, 10 years old now. Okay, they're getting it much younger. Well, all these diseases are caused by free radical damage. And so it's the diet. It's diet-related. And so what they have to do is change their diet, first of all. And how much does your aunt weigh?
She's probably 190. She's about 5'4", 5'5".
Okay, so she's a little bit overweight. Yep. And so we need to deal with that. And this probably relates to, do you know her well?
Yes. Mm-hmm.
Okay. So does she have any skin problems, any eczema, dermatitis, or psoriasis?
She has. Yes, she has.
Okay. And any bowel problems, she ever complain about her belly hurting? Does she have constipation or diarrhea?
Not sure of that. Not sure.
Okay, so you can ask her that for later. And then what about respiratory stuff? Any asthma, bronchitis, or chronic lung infections?
I think asthma, because she has a very difficult time even speaking.
Okay, does she
have
inhalers or respiratory things that she uses for medications?
Yes.
Okay, yeah. This is a Shar thing. Shar, what's Trey's aunt's basic underlying problem?
She has gluten intolerance.
Absolutely. And you've been very experienced with people with ALS and Parkinson's disease and so forth. At 190 pounds, how many eggs would you give Trey's aunt per day?
Probably 8 to 10 at least.
Yep, exactly. 4 to 6 per 100 pounds of body weight. So 190 pounds, I'd give her anywhere from 8 to 12 eggs a day. They got to be poached with soft yolks, soft boiled with soft yolks, soft scrambled in butter, not margarine or oils. And none of the inflammatory things that's going to cause free radical damage to the brain. No fried foods, no processed meats with nitrates and nitrites, no oils, and no gluten, no wheat, barley, or oats, because she does have a gluten intolerance, as Shar said. She has to be totally drop-dead gluten-free. Everybody in the household, including the dog, the cat, the bird, the fish, the man, the mother-in-law, everybody has to be gluten-free in the house to prevent cross-contamination. And then, for 190 pounds, what supplement program would you start Trey's aunt on, Shar?
2 healthy heart and brain packs.
Very good. I'd turn that around and make it 2 healthy brain and heart packs, but it's the same deal. Officially, they'll find it in the catalog as a healthy brain and heart. You're just testing me, I know. Okay, 2 healthy brain and heart packs. I used to make the same mistake. Okay, it's the 2 healthy brain and heart packs per month. That'll allow her to have 3 selenium twice a day, 1 ounce of the Osteo FX Plus at breakfast and dinner, 2 scoops of the Beyond Tangerine 2.0 NutriCrystals for breakfast and dinner. 3 of the EFA Plus is a breakfast and dinner. 3 of the EFAs a breakfast and dinner. All that would be accomplished, Trey, by the 2 Healthy Brain and Heart packs per month. It would also give her some really serious antioxidant power here. Which way would you go with the antioxidants for the brain, Shar?
I would give her the triple treat chocolate.
Well, I know that's your favorite. Triple treat chocolate, your aunt can have 6 of those a day. Each piece is the size of a pat of butter. And having 6 of those chocolates is going to give her 100,000 ORIC points per day. I like that. In fact, we were driving from Fort Wayne, Indiana today to get down to Grand Rapids, Michigan. We were eating these little triple treat chocolates, really like candy, but they're actually a great supplement. That gave us, we got at least 100,000 ORIC points today while we were driving and singing along with disc and so on. And another option, if she's allergic to chocolate or doesn't like it, can't imagine a woman doesn't like chocolate, I'd have her use the Cell Shield RTQ, 5 of those capsules twice a day. And let's see here. Also, for memory, cognition, problem solving, to really help the brain make neurotransmitters. It's a raw material for neurotransmitters. The Smart FX. I'd have her take 9 of those a day. 3 at breakfast, 3 at lunch, 3 at dinner. And then give us a call every couple of weeks. Let us know how she's doing. Once we get the brain thing, the ALS, on the rails. And, Shar, you've seen people totally reverse ALS, haven't you?
Yes, I have.
Okay. And so we do this with ALS, Parkinson's disease, MS, and again, Huntington's disease. None of these are genetic. None of them are autoimmune. They all are free radical damage to the brain. It's just a matter of what part of the brain is affected, what symptoms you get. And doctors don't know the underlying cause. And almost always, I don't know, it must be 90-95%, it's an underlying gluten intolerance. Okay, give us a call every couple of weeks, Trey, and let her know how she's doing. Okay, Doug, let's go to callers.
All right, let's head to Indiana. And Bob, you're on with Dr. Wallach.
Okay, Bob, you're on the air.
Hello, how you doing, Dr. Wallach?
Fine, sir, thank you. How can we help you?
I have a question about my wife. A few months ago, she started getting up in the mornings, real dizzy, walking around, running into walls, and she went to the doctor. They did a bunch of tests. I've never heard of a DAT scan. They did one of those. They diagnosed her with idiopathic Parkinson's, as well as
idiopathic Parkinson's.
Yeah.
Okay. What else did they diagnose her with?
With a diffuse Lewy body disease.
Oh, Lewy body.
Lewy, yeah.
Yeah, Lewy body. This is kind of a dementia, Lewy body disease. It's actually little things inside of each cell. These Lewy bodies look like spots under the microscope. Okay, they're called inclusion bodies. Okay, and these Lewy bodies, named after Dr. Lewy. They always name it after themselves, right? And this is, again, free radical damage to the brain. And idiopathic means the idiots don't know what it is. Okay? It just says we don't know. But it looks a little bit like Parkinson's disease. Does she have palsy? Does she have kind of tremors?
No. It's just the dizziness and can't hardly walk straight. You know?
Okay. And this is constant or comes and goes?
Pardon?
Is it constant always, or does it come and go?
Yes, all the time, from the time she gets up till she goes to bed. Yeah.
Okay. Does she have a problem when she sleeps?
No.
Okay, very good. So sleep quiets it down. Well, hang on. We'll come back. We'll give you some recommendations after a few more questions after these messages. We're back with Dead Doctors Don't Lie, the ZBS Radio Network. Dr. Joel Wallach here for Longevity and the Great Crusade. Okay, and we do have, I guess this is the last segment here. Okay, let's go right back to Indiana and Bob. Okay, let's see here. One more piece of information I need. When your wife is dizzy, does she complain about nausea, like motion sickness, or does she have any ringing in her ears?
No, none of that. You know, it's just her equilibrium is off.
Okay, I understand. Okay, what does she weigh? What does she weigh again?
Probably 140.
Okay,
5'5".
Okay, 140. Okay. Does she have any other issues? Any diabetes, arthritis?
No diabetes.
No high blood pressure?
No high blood pressure.
Is she on any medication? Is she on a medication for anything?
She's on a lot of different medications right now. In fact, they just started her on this Cinemet.
Mm-hmm. Did it give her any improvement?
No, she's been taking this now for 4 weeks. Started out at a half a tablet in the morning, half at night, and now she's up to 1 full tablet in the morning, 1 full tablet at night.
I give it another month. If you don't see any benefit, I just drop it. Okay?
Yeah.
Yeah. Okay, so at any rate, let's see here. Okay, we know about the eggs, right? 140 pounds. How many eggs would you give her, Shar?
140 pounds, I'd give her probably 6 eggs a day.
Okay, very good. 6 eggs a day, 3 in the morning, 3 in the evening. They had to be poached with soft yolks, soft boiled soft yolks. This is to rebuild the myelin in the brain. And does she have any arthritis or anything like that?
No arthritis.
Mm-hmm. Okay. And let's see here. Okay. None of the bad stuff. No fried foods, no processed meats, no oils, no margarines, no gluten, no wheat, barley, rye, and oats. That's the shortest way to say everything. No wheat, barley, rye, and oats. No fried foods, no processed meats, or oils. And then 140 pounds, what program would you give her? Because Shar, she's got this ataxia, this dizziness.
Oh, yeah. And couldn't it even be caused by low blood pressure? I mean...
Well, that's possible, but she has these Lewy body problems here.
Okay, so, yeah, I would give her, well, probably to start out with, I'd give her 2 of the heart and brain and heart packs.
Yeah, I would, too. Even though it's a little bit, it's like 10% too much, but I'd still go with 2 healthy brain and heart packs. It'd be 3 of the selenium at breakfast and dinners, 1 ounce of the OsteoFX Plus at breakfast and dinner in case she's got osteoporosis of the skull, squeezing the vestibular branch of the cranial nerve is kind of common. But I would also have her take that 1 ounce of the OsteoFX Plus at breakfast and dinner, 2 scoops of the Beyond Tangerine 2.0 NutriCrystals at breakfast and dinner, 3 of the EFA Pluses at breakfast and dinner, and 3 of the EFAs at breakfast and dinner. All that be accomplished by the 2 healthy brain and heart packs per month. I would also get some of the CM cream. Get 2 jars of CM cream, wide mouth bottles, and put some of that, maybe a half a teaspoon, down in each ear when she wakes up in the morning, again at 3 in the afternoon, with a Q-tip, like she's trying to get wax out of her ears. Let her do that and see if we can't relieve some of that symptomatology. And I would also have her take 9 of the Smart FX capsules a day, 3 at breakfast, 3 at lunch, 3 at dinner. That'll be 3 bottles a month, and that is for the DHAs and EPAs, which are the raw materials for the brain to make neurotransmitters for memory, cognition, and actually some motor function, which may be, being affected here either by the same thing that's causing the dementia or the dizziness, the ataxia. So this is, and we have to work on this. I want you to call me every 2 weeks and give me some kind of sense whether she's getting better or not. We'll tweak this a little bit as we go along here. Okay, Doug, how much time we have?
You got about 10 seconds.
10 seconds. Well, I'm going to go ahead and take it. Remind everybody to get one of my newest books, Epigenetics, The Death of the Genetic Theories of Disease Transmission. Epigenetics, The Death of the Disease Transmission, of the Gene Transmission, Genetic Transmission. And ask your longevity associate for this book and ask him how you can get immortalium and keep your telomeres alive and live longer. Okay. Well, thank you so much, Shar. Good job as usual. Thank you, Doug and Richard. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.